Hi, my name's Rochelle. I'm a friend of Mr. Jimenez, and I'm excited to talk to you today on Career Day about my career as a registered nurse. I became a registered nurse. I went to community college. I did the prerequisite courses required to apply to nursing school, also through community college. So I ended up graduating with my associate's degree in nursing, and then I was able to sit for my national nursing license exam. It's also known as the NCLEX. Then once I completed that, I ended up going back to school online for my bachelor's. I work in a hospital that requires 12-hour shifts. Some require 8 or 10, depending on the specialty. There's OR, there's pediatrics, there's the emergency room, there's oncology, there's a whole bunch of different specialties, but the one that I am currently in, I'm in the intensive care unit, and we also have open heart patients, so patients who are getting heart transplants or any open heart procedures, as well as trauma. So I'm certified in critical care and trauma. So basically in the ICU, patients are monitored closely. We come up with extensive care plans that are tailored to each patient, to what they need in their recovery process, and we examine them. We perform basic tests, we draw their lab work, we monitor their lab work, we give them medications, we provide alternative treatment options. And there's also a lot of education that goes into this, so we develop a relationship with not just the patient, but the patient family to make sure they understand the preventative measures from this happening again and coming into the hospital, or what to expect when they go home. What I like most about my job is that I'm only required to work 3 days out of the week, so that gives me a lot of time to do the things that I like to do outside of work and separate myself from work. And every time you go into work, it's completely different. You don't go in doing the same thing every day. But that could also be what's challenging about the profession, because there's so many unexpected circumstances, and you have to be able to work well under that pressure, because an accident can happen at any time and you get a trauma, or your patient who you think is totally stable and fine 1 minute could start crashing on you the next. And you have to be able to work well under that stress, because you have someone's life in your hand. But once you get them better and you see them recover after all that hard work, it can be extremely rewarding. I think there's a lot of good things you get to experience as a nurse, and I hope you enjoyed hearing about what I do. If you have any questions, just reach out to Mr. Jimenez, and I wish you well and hope you all stay safe.